All right, let's talk about that stubborn shoulder pain. If you've ever dealt with it, you've probably heard about injections. But what's the real story? Today, we're getting into the science behind two of the biggest options to answer one huge question. Are we just looking for a quick fix, or can we actually repair the damage for good?
You know how it goes. It always starts out as, well, nothing. Just a tiny little twinge you barely even notice. And then one day you do something totally normal, like reaching for something on the top shelf, and boom, that little twinge is suddenly a sharp, very real pain.
So when you've tried resting it, you've done the physical therapy, and that pain just isn't going away, what's next? What are the real options on the table? Let's see what the research has to say.
Okay, first things first. Before we can talk about fixing the problem, we need to put a name to it. What exactly is going on inside that shoulder?
For a lot of people, the culprit is something called rotator cuff tendinopathy. Now, that's just a fancy way of saying the tendons in your shoulder are getting irritated and starting to break down. It's super common, especially if you're over 40. And here's the kicker. If you just ignore it, it can actually turn into a more serious tendon tear.
All right, so when it comes time to consider an injection, doctors usually have two very different paths they can take. Let's meet the contenders.
In one corner, you've got the veteran, the good old corticosteroid injection. This has been the go-to for decades. Why? Because it's a powerhouse at knocking out inflammation and giving you fast pain relief. And in the other corner, you have the challenger, platelet-rich plasma, or PRP. This is a much newer approach that actually uses healing components from your own blood to try and kickstart your body's natural repair process.
So you can already see we're talking about two completely different philosophies here. Let's dig into how each one actually gets the job done. I love this analogy because it makes it so clear. Think of a corticosteroid shot as a fire extinguisher. Its job is to rush in and put out the raging fire of inflammation right now. Fast, simple, effective. PRP, on the other hand, is more like a construction crew. It doesn't just douse the flames, it shows up with blueprints and building materials, all those growth factors, to actually help rebuild the damaged tissue from the ground up.
And here's the science behind that analogy. Corticosteroids work through suppression. They just shut down your body's inflammatory process. But, and this is a big but, the research shows that using them over and over might actually weaken the tendon in the long run. PRP is the total opposite. It works through stimulation. It's actively trying to get things going, encouraging new cells to grow and helping to remodel the tissue. Two completely different game plans. So you've got suppression versus stimulation, the quick fix versus the rebuild. So which one actually works better for people? Well, this is where it gets really, really interesting.
After looking at a whole bunch of studies, the science is pretty clear. The single biggest thing that separates these two treatments isn't about which one is better overall. It all comes down to one thing: time.
Check out this timeline. In the beginning, for the first 3 months or so, corticosteroids are the hands-down winner. They deliver that fast pain relief people are looking for. But watch what happens as you go further out, to 6 months, even a year. The effects of that steroid shot start to wear off, and that's right when PRP starts to shine, showing the potential for improvement that actually lasts.
And hey, don't just take my word for it. This is a direct quote from the analysis. It confirms exactly what we just saw. Steroids win early. PRP might win late. But, did you catch that last part? Though results were inconsistent. That little phrase is super important, and it leads to our next big question.
Right, so if PRP has all this potential for long-term healing, why aren't the results a slam dunk in every single study? Well, there's a catch.
This is the million-dollar question, isn't it? If PRP is supposed to rebuild tissue, why are the studies so all over the map? Well, the answer is pretty simple. Not all PRP is created equal, not even close.
You see, PRP is actually a huge umbrella term. How the PRP is made, its exact ingredients, how much is used, and even precisely where it's injected, all of these variables can dramatically change the outcome. This makes it incredibly hard for scientists to compare one study to another. It's like comparing apples, oranges, and, bananas.
And then there are the practical things you have to think about. Cost is a huge one. Steroid shots are generally pretty inexpensive. PRP, on the other hand, can be much more expensive, and insurance often won't cover it. And then you have to think about the goal. If you've got a sudden, acute flare-up, a steroid shot can calm it down fast. But if you're dealing with a chronic problem and your priority is long-term health, that's when PRP starts to look like a really interesting option.
Okay, so we've got the timeline, the scientific inconsistencies, the cost. With all of that on the table, how in the world do you and your doctor actually decide what to do?
Well, the study actually proposed a kind of decision-making map, like the one you see here. Now, don't worry about reading every single word. Just look at the general flow. You always start with the basics, right? But if that pain sticks around for more than 3 months, you can see how the conversation starts to shift, and the option of PRP gets put on the table as a serious consideration before jumping to something more invasive. And that really brings us to the most important takeaway of all. There is no single winner here. This isn't about corticosteroid versus PRP. The absolute best choice is the one that's personalized for you. It depends on your goals, what your specific injury looks like, and, of course, having a really good conversation with your doctor.
You know, it kind of leaves you with a bigger thought. As we get smarter about treatments like PRP, it makes you wonder, maybe the future of medicine isn't about finding one universal cure for everyone. Maybe it's about getting better at harnessing the incredibly powerful and unique healing system that's already built right inside each and every one of us.